Empathy, understanding, and knowledge are the first steps towards managing any pain, and menstrual pain is no exception. Let's dive into the heart of the matter, shall we? Menstrual pain, also known as dysmenorrhea, is a common symptom that many women experience with their monthly period. It's estimated that up to 3/4 of women have experienced menstrual pain at some point in their lives. Yes, you heard it right, 3/4. That's a staggering amount, isn't it? This pain can vary in severity, from mild discomfort to debilitating pain that can interfere with daily activities. Some women describe it as a dull, constant ache, while others may experience sharp, throbbing pains. It's different for everyone, and it's important to remember that each person's experience is valid. But menstrual pain is not just a physical issue. It also has significant impacts on mental and emotional well-being. It's not uncommon for women to feel irritable, anxious, or depressed during their periods. The physical discomfort can also lead to feelings of fatigue or even a reduced ability to concentrate. Imagine having to go through this every month, and in some cases, for several days at a time. Menstrual pain can also have far-reaching effects on a woman's life. It can affect performance at work or school, and even social relationships. It's not just about the physical pain, but the ripple effects it creates in daily life. It's critical to understand that menstrual pain is a real, tangible issue that millions of women deal with. It's not something to be dismissed or minimized. Menstrual pain is a part of many women's lives. It's not a sign of weakness or something to be ashamed of. It's a natural part of the menstrual cycle, and acknowledging this is the first step towards managing it effectively. So let's keep the conversation going. Let's normalize discussions about menstrual pain and continue to educate ourselves and others about it. Because the more we understand, the better we can support those who are dealing with it. Remember, menstrual pain is not a sign of weakness, but a part of many women's lives. To understand how to manage menstrual pain, it's crucial to know what causes it. The pain that many women experience during their menstrual cycle is not a mystery, but the result of a well-coordinated biological process. Menstruation is a natural part of the reproductive cycle, where the lining of the uterus, or the endometrium, prepares itself for a potential pregnancy. If pregnancy does not occur, this lining sheds, leading to a menstrual period. Now, the shedding of the endometrial lining is not as simple as it sounds. It is a process that's influenced by several factors, predominantly hormones. One such hormone that plays a pivotal role is prostaglandins. Think of prostaglandins as messengers that the body uses to communicate internal changes, particularly within the uterus. When the lining of the uterus begins to shed, the levels of prostaglandins rise. These hormones trigger the muscles of the uterus to contract. Now, these contractions are necessary for the body to expel the lining. However, they also compress the blood vessels in the uterus, temporarily cutting off the oxygen supply to the uterus's muscle tissue. It's this lack of oxygen that causes the sensation of pain. The level of prostaglandins and the intensity of uterine contractions can vary greatly from woman to woman. This variation is the reason why some women experience severe menstrual cramps, while others may not feel much discomfort at all. It's also why the pain can fluctuate from cycle to cycle for the same woman. But remember, menstrual pain is not just a physical process, it also has psychological implications. It's not uncommon for women to experience mood swings, fatigue, and even depression during their menstrual cycle, all thanks to the hormonal changes happening in the body. Understanding the cause is half the battle won. Now let's delve into the effects of menstrual pain. Menstrual pain doesn't just cause physical discomfort, it can also significantly impact a woman's daily life. Let's delve into the physical effects first. The most common symptom is, of course, the pain. And this is not just any pain, it's often described as intensely sharp, throbbing, or cramping, concentrated in the lower abdomen. This can be so severe that it disrupts daily activities, making it difficult to focus on work, studies, or even simple tasks. But the physical discomfort doesn't stop there. Many women experience nausea, a symptom that can make even the thought of food unappealing. This can lead to weakness, further exacerbating the fatigue that often accompanies menstruation. Yes, fatigue is another common effect of menstrual pain. It's not just about feeling a little tired. It's a kind of exhaustion that can make getting out of bed feel like climbing a mountain. Now let's shift gears and talk about the psychological effects. Mood swings are a well-known side effect of menstruation, often characterized by sudden shifts from happiness to sadness or calm to irritation, but it's more than just moodiness. For some women, menstruation can trigger episodes of depression or anxiety, creating a mental and emotional struggle that's just as real and challenging as the physical pain. It's important to remember that these effects are not the same for everyone. Some women might experience all of these symptoms, some might experience a few, and some might experience none at all. The intensity of these effects can also vary greatly from person to person. One woman's mild discomfort could be another woman's unbearable pain. But why is it important to understand these effects? Because knowledge is power. By understanding the potential effects of menstrual pain, women can better prepare for them, seek appropriate care and treatment, and communicate their experiences to others. The effects of menstrual pain can be wide-ranging, but knowledge and understanding can help in managing them. While menstrual pain can be challenging, there are several ways to manage and alleviate these discomforts. It's no secret that enduring menstrual cramps can be a daunting task, but the good news is there are numerous ways you can find relief. One of the most common methods people turn to is over-the-counter medication. Non-prescription pain relievers such as ibuprofen or aspirin can help reduce the intensity of cramps by lowering inflammation and pain. However, it's important to remember that while these may offer temporary relief, they are not a long-term solution. Another widely sought-after solution is heat therapy. Applying a warm compress or heat pad to your lower abdomen can help relax the muscles and reduce cramps. The heat works by increasing blood flow and soothing the pain. It's a natural, non-invasive way to manage discomfort during your period. Exercise might seem counterintuitive when you're in pain, but it can actually be quite beneficial. Light activities like yoga, walking, or swimming can help ease cramps by encouraging blood flow and releasing endorphins, the body's natural painkillers. On the other hand, your diet can also play a significant role in managing menstrual pain. Consuming a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help maintain a healthy hormonal balance, which in turn can alleviate menstrual discomfort. Drinking plenty of water helps to avoid water retention and bloating, common issues during menstruation. Lastly, maintaining a healthy lifestyle is crucial. Regular sleep, stress management, and avoiding excessive caffeine and alcohol can all contribute to more manageable menstrual pain. It's about creating a lifestyle that supports your body and its natural processes. In conclusion, managing menstrual pain is about more than just popping a painkiller. It's about understanding your body and finding what works best for you. Whether it's heat therapy, exercise, a balanced diet, or a combination of all these, finding your unique solution can make a significant difference in your comfort levels during your period. Remember, it's not about enduring the pain, but about finding ways to live comfortably with it. It's time to summarize what we've learned about menstrual pain. A complex yet essential part of the reproductive cycle, menstrual pain is often misunderstood and under-discussed, yet it's an experience that many people go through every month. We've delved into the science behind it, learning that it's not just a bad period. It's a physiological process where hormones trigger contractions in the uterus, leading to discomfort and pain. This pain isn't a sign of weakness, but rather a natural response to these hormonal changes. The effects of menstrual pain aren't confined to the physical. It can impact mental well-being, productivity, and daily life. It's not just about the physical discomfort, but also the emotional toll it can take. It's important to acknowledge these effects, not to belittle them or brush them aside, but to understand and empathize with those who experience them. Empathy and understanding are key here. By acknowledging the challenges menstrual pain can bring, we can foster a more compassionate and supportive environment. It's about recognizing that everyone's experience is unique, and what might be a minor inconvenience for one person could be a significant obstacle for another. We've also explored various ways to manage menstrual pain, from maintaining a healthy lifestyle with regular exercise and a balanced diet, to utilizing pain relief methods like heat therapy and over-the-counter medications. There's also the importance of medical consultation for severe or persistent pain. It's not a one-size-fits-all solution, but rather a toolbox of strategies that can be tailored to each individual's needs and circumstances. Let's not forget the power of social support and understanding. The strength of a kind word, a listening ear, and a supportive shoulder can't be underestimated. It's about creating a culture where menstrual pain is not a taboo subject, but something that can be openly discussed and addressed. Remember, menstrual pain is a common experience, but it doesn't have to control your life. With understanding, empathy, and action, you can manage it effectively.